My name is Blythe Lord. I am the founder and executive director of Courageous Parents Network. Some of you I know, most of you I think I don't. Joining me are members of the CPN team that include Jennifer Seidman, Allison Mee, Liz Morris, Janet Duncan, and our special guest, Justine Romano, who we've met, who we know through some of the work we've done together. This is Courageous Parents Network has never done anything like this before, where we have partnered with an external media. Usually we produce all of the content ourselves, all of our videos and blog posts and podcasts. But when the opportunity to do something with the film Unseen presented itself, we jumped at it. First of all, we watched it and we thought it was worthy of sharing and getting behind for others to see. And also, and more importantly, because we have been hearing, well, as parents ourselves, we have experience with the caregiver burden, but also we have been hearing in all of our travels at Courageous Parents Network about the caregiver burden, whether that's specific to a lack of respite care or in-home nursing care or opportunities, or just the psychosocial and emotional burden. We hear about this a lot. And so we wanted to bring those of you who are on the front lines, the parents especially, but also the clinicians who support these families together to have a conversation about this burden, using the film and what we've all watched as a jumping off point. And then we will be capturing what you have to share. The facilitators that I've named, we will be capturing what you've had to share and turning your wisdom, your comments, your reactions into something that will inform the programming we develop at Courageous Parents Network, or the programming or a mini manifesto that we take out to clinicians, industry, patient disease groups, policymakers, anyone who is in the space of supporting families. So we don't know yet what we are going to do with what you share with us. We just know that as with everything at Courageous Parents Network, it begins with the caregivers, parents first and foremost, clinicians also. And from that, we will turn it into something that we can use to help others like you in this situation. So that is our intention for this evening. I do want to flag that we did not produce the film. So in our conversation tonight, when we go into breakout rooms, because that's what we're going to be doing, going into facilitated breakout rooms so that we can get into things a little more deeply without as many people in the space. We ask that you not comment on the artistic merit of the film. We are not here to talk about the artistic merit of the film. We are here to talk about what resonated with you, what you felt was missing, what came up for you, what your reactions are to those things. We're going to go in, you will share your thoughts as prompted by the facilitators. We hope you will turn your camera on to do that. You can raise your hand if you want to say something, or you can put your name in the chat to say something, and then the facilitator will call upon you. Each facilitator in the breakout room will be taking notes. And then when we come back after the 25 minutes in the breakout room, the facilitator will be reporting to the entire group what was shared in the room. So we will collectively hear what individually was shared in each room. What else? Okay, before we get there, we do have two poll questions actually. So Allison, will you share please the poll? And if you would take a moment, regardless of your role, whether you're a parent or a clinician, to answer these questions. question one, which aspect of the caregiver experience most resonated with you? Please choose one. And the second question is, the film Unseen explored much of the caregiver experience. Which important topics were either absent or underexplored, did you feel? While the primary focus of this is on the parent as caregiver experience, clinicians are also caregivers. They are caregivers to the children and they are caregivers to the families. And while we know that families are under, that our society and our system in too many ways is broken or uncoordinated or underfunded and under-resourced, and there are lots of different reasons for this, and that the brunt of this pain is felt by parents and family caregivers. It is also the case that clinicians, for whom it is their job, they have chosen to work in the field of supporting children and families, they too feel the burden of not being able to get everything to families that they would like. So I do want to say that clinicians who are in the group, you get to talk about that. Please do not feel that you don't get to talk about that. You can either talk about what you've observed from families or what you've observed coming up for you yourself in your professional capacity. Okay, so I think without further ado, I am going to, is there anything else to say before I send you all into breakout rooms? Jennifer, did I forget anything?
No, I think you've done a great job. I'm looking forward to speaking with everyone in the breakout room. And I will tell you, when you get in there, your monitor or hostess will identify themselves. And if you want to make sure they're on the front of your screen all the time, you can use that little 3 buttons right there that's in the corner of, for example, my picture, because to pin me to the top of your screen. So if that makes it easier for you. Visually, that usually makes it a little smoother for me.
Okay, so so just a reminder, each of you will be sent into a breakout room. We're going to create 5 breakout rooms. Each of you will have a facilitator who will prompt you. Please be as honest as possible, but also don't talk longer than need be, so to give other people a chance. Just be very direct that way. No criticism of the artistic merit of the film. We encourage you to keep your camera on. You can raise your hand or put your name in the chat. And then after 25 minutes, you will come back and we will share out to the group. Okay, so here we go to breakout rooms.
So I have three children. My youngest, Katie, is 31, and she has quite significant developmental intellectual disabilities. One of the things that I wasn't 100% sure until I saw the film whether we were going to like sort of fit this group is because she's really not. I wouldn't describe her as medically, like having a lot of medical issues, but so much of what the film touched on spoke to us nonetheless. So.
All right, well, I'm glad you're here. How about Rebecca?
Hi, I'm Rebecca. I have 4 children with disabilities. My oldest is 24 and she has an undiagnosed autism. And my second child has cerebral palsy, and he was the first one we really had, I guess, experience with. And when we get to the resignation part, I'm sure all of us had feelings that that resonated with us. He was premature, and has cerebral palsy. He's 20, he'll be 23 tomorrow. Oh goodness. And then I have an 18-year-old with autism and a 14-year-old with autism. So I'm happy to be with y'all tonight.
Thanks for being here. Deb?
Hi, I'm Debbie LaFond. I am a nurse practitioner, been in pediatric oncology, so taking care of kids with cancer, and in palliative care for about the past 29 years or so. I recently retired from my clinical practice and am now doing more education in pediatric palliative care. And don't forget Ivy, who we had
Right.
muted, but I think she's unmuted now.
Thanks, Deb.
Yeah.
Okay.
So I Zoom all the time, but somehow the view of your squares with the screen in the background, it just was mysterious where the unmute was. So I'm Ivy, and this is my daughter, Sophie.
Hi, Sophie.
Sophie has a rare genetic syndrome. However, she does not meet, I know there's no standard universal definition, but she does not meet the definitions that are out there for medically complex. Although when she's 28 now, and she had 11 doctors when she was 12, that we've decreased considerably over time. But there are children with her diagnosis, and there's only hundreds, 500 at the most that we know of, including adults with her syndrome who do meet the definition. But I come to this because I work in our maternal and child, well, Sophie brings me to this, as all our children might, but I work in maternal and child health in our Title V program in Texas. I don't know if that's foreign language or familiar, but Texas was one of 10 participating states in a national project focused on improving the well-being and quality of life of children with medical complexity and their families. And along the way, we met Blythe and were introduced to courageous parents. And so I've worked and learned from families of children with medical complexity and adults even prior, but more intensively these last 4 or 5 years. And like Kathy, you know, so much resonated with me too.
Well, hold that thought for a minute, and I'll just let people finish introducing, and then we'll.
Here I am. Yeah, thank
hear from
you.
Again, okay, great. Suzanne?
Hello.
Hi.
Hi. I'm Suzanne Gwen, and I'm here in Seattle, and I've been a registered nurse for 39 years. And pretty much 35 of those has been primarily pediatric hemonc, bone marrow transplant, and then also working labor and delivery with some adult hospice and some adult hemonc in there. And so recognizing the need for caregiver support many, many years ago when I was still on the bone marrow transplant unit at Swedish with the Hutch, Fred Hutch, and watching parents coming not just from around the country then, but all around the world. And we have 4 states around us that don't have children's hospitals. So watching parents come a long way, and then saying somebody should do something and someone needs to help, and learning that in the UK, they started building pediatric palliative care respite homes and end-of-life support back in 1982, Canada 30 years ago. But here in the United States, currently we have 3 operating that are just pediatric specific. And the primary goal, they call them hospices, but the primary goal is really pediatric family support. So here in Seattle, Ladybug House, I founded it in 2013, trying to build a respite home for families to support families who are supporting their children with life-challenging illnesses. So the kids, as they said, it really resonated me in the movie, the documentary, when she said, the children are as strong as the parents are. And the movie, I'm getting old, and it's much harder than I ever thought it would be, because who thought it would be that hard to build a place for support where families could either all come together and get rest and support, or where they could leave their kids for the weekend, like grandma's house, for rest and support. So it validated that, yes, there is still a need, and the need hasn't changed. And as I get older, I'm really hoping that one day all of you out there, you hardworking heroes, will have a place where your families can rest and rest together, with quality of life being priority, but also having options that are specifically pediatric and young adult supported for end of life and bereavement support.
We can hope, definitely.
We can hope.
Erin.
Hi, yes, I'm so sorry. I was just on another call on Teams, and this happened to me last week. For some reason, my camera does not like transitions from Teams over to Zoom because it will
Okay.
not let me unlock the video. So I'm
All right.
sorry you don't have a photo of me, but I'm Erin, and I'm so delighted to be here. My son Will lived 20 years with a neuromuscular condition, and he was trach and vent dependent, full care. He sadly passed away in November, but I'm still so happy to be part of this community. I also run a nonprofit for his rare disease nationally and work with families all over the country and actually internationally that are struggling to find support as caregivers. And in our case, a lot of the time, it's even needing the support of licensed nursing care. So.
All right, thanks, Erin. All right, so now I'd love to hear and have you share your thoughts with the group about sort of what your reaction was in watching the film to perhaps one of these 5 areas of support, perhaps the emotional support or the informational support, tangible support, the self-esteem, or just the sort of belonging. So I know some of you said you had things to share already. So do you just unmute? I think we're a small enough group. If you just unmute yourself, I'd love to hear your reaction. Kathy.
I think for me, the part that so much of it was well done. I mean, I just think it touched on so many issues in a short amount of time. It was quite extraordinary. I think the behavioral challenges and the way that is such a hindrance to being part of community in so many ways. All of that, all the things said around that really rang true for me. Something we've really struggled with. Yeah, I would say for me, that was, I was so glad they talked about it honestly, because I feel like that often is not talked about honestly.
So for you, that was validating to hear. And so that's something.
I mean, the scene that she sort of describes of being in the park, right? When her son is sort of having a meltdown, or, and feeling immediately aware of who's around, who's looking, what possible judgments are happening, and just feeling like it's just easier to stay home. We've been there many times, so.
Okay, thank you for that. All right, anybody else with reaction? Missy.
Although my is less behavioral, more medical, but related so much in the same way. There's nothing like whipping out a suction machine in the middle of a, big family dinner. Family even is just like horrified, and staying home. I mean, I have found over the last few years, as Oliver got bigger, he's bigger, I'm older, I'm chubbier, I'm less less fit. And it's just so much harder. Because of his seizures, I can't drive with him alone anymore. We have to have somebody. So now I'm dependent on others if I want to go out with my son, where, before we could always I could just pop him in the car and we'd go. And now I am dependent on somebody else. And even if I have that other person, a lot of times it's just so intimidating, so much work, that it's just easier to stay home. But that's so isolating. And I find a lot of my outings that I'm looking to go to are like of friends from his center-based program when he was younger. But none of them are very physically involved. So, they'll have a beach outing, which is not really possible with the wheelchair, or, so I find that I'm even isolated from the special needs groups. So it's just, I related so much to all of that. And these types of support, they talked about each one of these. I was waiting and waiting for the golden answer. It unfortunately didn't come. I don't know why that surprised me, but I'm hoping that's what this is working towards.
Definitely. We'd all love to find that golden answer for sure. Because that, Ivy, I think you were going to talk about your reaction too. Thank you, Missy.
Yeah, thanks. I so appreciate hearing everyone's perspectives, and I'm mostly here just to take it in. And I remember the first time a mom told me, I wasn't working in public health or anything. I was home with Sophie and my son, and they talked about being shut in. And I'd never heard that. This was a long time ago, maybe 15 or more years ago. And now I have a number of friends who have children who are adults, who are big. I remember a mom I met online through parents stuff, wanted to get together, and we made a plan, and she texted me, "I'm so sorry, I'm running late. It was a rough night." And when she comes, she has a black eye from her son, from the behaviors. And we haven't figured this out. In thinking about emotional support, in 28 years, one thing is that I found that truly wonderful people come into our lives. Like my daughter, and I know a lot of families that feel that way, are magnets for so much goodness. It's also true that we encounter people that step back and don't know how to talk to us, or they look at us with pity. And as wonderful, I have really wonderful friends who aren't connected personally to disability and rare conditions with their children. And I feel like they're very dear friends, but the people that I feel, love means never having to say you're sorry. We don't have to say anything. We all understand each other. Like, it's just there. And so that's my life raft. And so with or without complexity, I think, our families who have children with mental health conditions, and so, there is such a divide, and we do get looked on with pity. So the belonging and the support is kind of tied to that, because that's where we we just all get each other and no apologies, and we can go months without talking to each other and nobody's keeping track of that because we all know why. I'm all there.
We're all kind of in that bowl of soup together. Yeah.
Yeah, and the mom with 8 children, and I mean, her expression of her, all the parents, how they described and painted a picture of the realities is so important. And we're the choir. So where does this go? And how does the community around us see and hear? Because I was thinking the movie's called Unseen. I think it's unseen and unheard.
I'm just curious, as a follow-up, you mentioned that you found some truly wonderful people. I'm just wondering if you could share like who those wonderful people are for you.
Right. Well, when, you know, Sophie was 12 hours old, the doctor came to my bedside and, you know, she actually didn't get a diagnosis till she was 21. It's not like I went chasing one forever. I gave up many more years than searched. But when she was 4 months old, a physical therapist came and she just had an aura about her. And she came 3 times a week. You know, early intervention was different then. Sophie had 8 therapies a week. And she always showed me something Sophie could do that I may never have realized. And 3 times a week, there was always something. So the support and the hope, right, that she brought. And then in Texas, you know, with Sophie being on a Medicaid waiver, pre-COVID, you know, we've had support and attending care. And oh my gosh, like we have some who are in our lives now that we've known for 10 years or more, who aren't even on our weren't even on the payroll when the pandemic started, but stay with us. In Texas, there's been a big effort by our parent-to-parent statewide group to advance the model of a personal support network. And it took me a really long time to have the courage to do this because we don't really have family. So I had to ask friends, and it took years. But then I finally did it, and her network is going to be 8 years old this next month. And there's about 20 people in it. And we have met every quarter for 8 years. Like,
Wonderful.
you know,
yeah.
They all have wings and halos, so different ways. Sorry, I didn't want to take up too
That's
much.
great.
I know don't keep asking me because I talk too much.
All right. How about, I don't want to necessarily call on you, but I'd love to hear, Rebecca, did you have a reaction to any particular part of the film, or?
You know, I don't think I mentioned it before, but it sounds like, Ivy, that we may work for similar, I work for my state's Family to Family Health Information Center. Okay, and we're also our parent to parent, and I live in Virginia. You know, one thing that I thought of with connection to community, I really don't have any close connections. Part of it was we moved during COVID, we moved to a new house, a new neighborhood, and we haven't met anybody yet. Like we know the people next to us, but we don't know anyone else. But one of the things I was thinking of is I get along with my coworkers because we are all parents of a family member with a disability, and they understand how how we feel, like I guess is the best term. One of the things from the unseen that I really thought about, that she was talking about how, and maybe it was just me adding this on, that I'd wished I spent more time just being in the moment with my child. I remember having so many therapy appointments. He was only a few months old and we were attending physical therapy 3 times a week. And I just thought about, the doctors. And so my brain, instead of being in the moment, my brain would be fast forwarding to next week. Okay, which, what do I have? He has therapy, which day? He has a doctor's appointment, which day? And it was just always looking ahead. And so my brain would just keep going. And probably why I just felt anxiety all the time. I hope that we get to talk somewhat about siblings, because siblings, my oldest daughter really kind of, I guess, suffered in the beginning. We had to keep my son home for 2 years because the doctor was afraid that he would get RSV. So we could never go to church. We could never go to my daughter couldn't go to a play group because fear of bringing germs home. So
Yeah. Oh, all right.
Sorry, I talk too much too.
No, it's just always, the time always goes too fast in these things. Erin, I just want to give you a chance.
Yeah, I just want to say the one thing that really resonated with me was, I've always said this, that my son was never a burden. It was the fact that the society isn't set up to help us alleviate burdens. So that's where my efforts really are, is looking at how can we have the infrastructure support from leadership to really set up systems that are better able to support us. Yeah, so that quote, it wasn't exactly that, but it was along those lines, that, our kids are not the burdens, it's the challenges created around broken systems a lot of times.
Right. So Justine, how about you go first?
Sure. Our room was room 4, and it was made up of 8 of us total. And we talked a bit about sort of the way in which the film addressed, captured those 5 areas of support well, and then some of the stuff that was missing. So first I'll talk about sort of the validation that people felt from the film to really resonate, the different aspects that was covered. Things like feeling very tired and their body being exhausted, the need for services. One of the things that was mentioned was everybody looking like they hold it together so well because there's so much to do, and all the praise that they get from providers from holding it all together. But really this missing piece being, I think the way one of our members talked about it was sort of like what has to be sacrificed from the caregiver themselves to make everything look like it's functioning so well. The other parts of what would a system even look like if clinicians started asking parent caregivers how they were really doing, and what that answer would be. And sort of this general feeling of a connection and community, seeing so many parent caregivers talk about their experience and really the different pieces that were discussed, very, very much so resonating with those. And then to switch gears a bit, some of the missing pieces that people thought about were what it would be like in terms of those that are continuing their family, and sort of comments and sort of family being in agreement or not in agreement, maybe some like cultural components that can come into that as well. Things like the sibling perspective and the aspect of how this impacts siblings, both with blended families and not. Another thing was that use of sort of, the full care aspect, but in the video, this child was able to walk. and sort of that the more care that's needed, the more intense needs somebody has, like, for example, certain food allergies are needing to make the child's food themselves, and, those aspects of things. So the concept of full care and how that can be different relative to who's describing it. And another piece was the diagnosis day. And the intensity of that and the variation of somebody's experience for that. Some of the things that were also discussed in terms of question number 2, sort of the area that's most helpful, just to summarize that quickly, it was the connection to groups, especially online communities, which some people were connected with, especially if there was a rare disease, and really having to utilize that even before Zoom became a thing, and online communities became something that everybody joined because of things like pandemic. But parent caregivers, that really being something that they've relied on for a long time. And then also finding information from other peers rather than organizations or clinicians giving information to parents, but actually being able to speak to somebody about how they problem solve, or something that has worked for them, or something that has happened before, that being sort of the crux and the most important information that some parent caregivers get. And then the tangible support for sure was echoed when you find, a really good, I think it was stated, like, when you find a really good help, somebody that can really assist with caregiving capacity, somebody that you trust, it can make a world of a difference. And then we had another member mention, but not just in a situation where it allows them to then do something secondary. So for example, the other tangible tasks that the family needs, or their own sort of work or employment, but actually care that would allow them to do the self-care that everybody tells them is so important and what's truly needed for their well-being. So I hope that summarized everything. I don't want to take up all the time that we have, but.
Wow, that was impressive, Justine. Justine is a medical social worker, so she's particularly good at summarizing. I just want to say, well, hi, Effie, and Barb. Okay, Liz, what did your room say?
Yes. Hi, I'm not a medical social worker. I've got a hard act to follow, but we had a really great discussion. I believe that everybody in our room was a parent caregiver, and we had a couple of people wearing parent caregiver hats, and also policy and or provider hats as well. So it was a great discussion. Very broadly speaking, for the first question around what folks felt the film captured well, or what might have been missing, people really felt like the discussion around respite and need for respite was well covered, and felt like having a social worker speaking in the film lent a social worker, and also some policy folks as well, lent a sense of credibility to the dialogue, especially when they said things that our society doesn't historically place a lot of value in caregiving, and that's a problem. And also when they spoke about the need to screen caregivers as part of providing good care to the impacted person or child. And we all really resonated around the idea that the health of the child is really dependent on the health of the caregiver, and that the film really addressed that well. People were curious and wish there had been a little bit more discussion about how parent caregivers and families are accessing information, because we know in our current information age, it's not just one-to-one with your doctor or doctors. There's lots of ways people are gathering and synthesizing information to take care of their child and take care of their family. And so we wish there had been a little bit more discussion around that. In terms of places where people have felt well supported in the different areas of support, we spoke largely about a sense of belonging and or self-esteem. It seems like those softer skills or are areas where we're able to find some of what we need, but it's kind of a complicated landscape. We talked about how when your child is diagnosed or you're part of a rare disease community, there's a lot of rapid relationship building that can happen in that disease or disability community. And then you become aware of other disease and disability communities, and you kind of feel a part of that. And then there's whatever your broader personal or general community is. So we talked about this idea of like overlapping rings of belonging that we can find ourselves in. But we also talked about how while that can be really positive and also very easily or relatively well facilitated by social media, there's also kind of a shadow aspect to that, in that a lot of people come into our lives or come into our children's lives, but then also leave, whether it's a provider that you've loved or somebody on their school team that you really cared about. There's a transitory nature to these really intense relationships as well, that we experience. And finally, when we talk about what could potentially be improved or specific areas of support that folks might need, we had a really great comment about the need to rethink what we mean by respite. Somebody noted that the standard definition of respite is right now really focused on providing care for the impacted child, but ideally parent caregivers can self-identify what respite actually looks like for them, and have resources that can help them with that. An example was shared about, having multiple kids and needing to get your impacted kid to appointment and bring all the other kids with you, or miss the appointment. And that's a really tough corner for a lot of folks to be in. So that was a very big regurgitation, but I really appreciate all the members of our group being vulnerable and honest.
That was very, very comprehensively done. Janet? So much smarts here, and really.
All right. Well, I always find I run out of time in these breakout rooms. Life, I always want more time.
Well, that I know.
I think the participants did as well, but I think a significant number of the caregivers had children who were older, and so had some medical needs, but also really were challenged behaviorally. And the overarching theme, I think, that our participants resonated with them was the isolation factor. That even being isolated from the special needs community, that maybe they were able to be a part of when their child was younger, but as their child grew older, or there were, or perhaps wheelchair bound, that then it just was easier to stay home. So that idea of being shut in, or really not being able to be a part of a community, felt very real. And that's, sort of was brought up well in the film. Another way it was isolating was that as their child got older, they couldn't transport them and couldn't drive alone. So they always needed a second adult to come with them. And so that, it just snowballs, I guess, as particularly as the children get older and have bigger needs. I think that another thing that resonated in some ways was that when the participant expressed that there were some truly wonderful people that came into their lives because of their child, and that somehow they were able to become a part of a community that, even though they perhaps didn't see each other often, that the community of parents with similar children can kind of talk the same language and can really be there for each other. Whereas there may be other friends that really the parent knows, cares for them, but maybe have stepped back, or even have that feeling that they're being pitied by some of their friends, and that doesn't feel good, and that's not what they're hoping for. Another piece of the film that resonated for one of our participants was that idea of trying somehow to stay in the moment, or wishing she could have, perhaps been able to do that. And that's often thinking about the next appointment or where the other children have, that raises that level anxiety that is high all the time. And finally, the thing that lacking, we echo the sibling piece, that that they suffer in so many ways. And so how to balance that really wasn't dealt with or talked about. All right.
That was the winner of the missing of the poll. What did people feel was missing? It was the sibling piece. And just so you know, I did ask the filmmaker about that, and or the producer, and her answer was just they were trying to keep it in a certain period of time, and they felt like that was almost a documentary unto itself. That was the answer she gave. So it was not lost on them that they didn't talk about the siblings. Jennifer, Erin, I just want to say that I see you, and hello, and Danelle, I see you, and I wish I knew all of your, I wish I had relationships with all of you, but for those who are like, okay, I want to say hi. Okay, Jennifer, your group.
So a lot of what we talked about has already been reported back, but I will say the first thing that came out was, and I think it's really important that everybody felt like this movie made them feel heard in a certain kind of way, and that it was very understandable and relatable to them. And even in the hardness of that, there was comfort. And again, like everyone else, most topics that came up that were sort of lacking or not so covered well in the movie were the sibling relationships, and even in some degree the marriage relationship or partner relationship, I should say, and family, extended family sort of disappearing, and how do you handle those relationships, and that was commonly heard in our group. And then I think some of the more interesting things that haven't necessarily been brought up with other report backs was that understanding that you have this need to take a break, but that it's very difficult to find the trust to do that, the trust in the caregiver, the trust in your emotional response when you come home and the thing didn't go exactly as you would have done it. And how do you develop that trust? And that really, there isn't anyone out there helping you do that. There's not a professional that you're leaning into, or somebody who's saying, here, come and learn from this, or learn about this. So that it's like a muscle that, you kind of have to build. And then that played into the fact that asking for some of those things gets increasingly hard as your child ages and grows. So when children are first diagnosed, and maybe in the early years, it seemed harder, or it seemed easier to ask for support and to find that trust to do it within yourself, but that it got harder over time as your child aged. And this constant perception that you're being strong and you're the great parent and you get everything right is fatiguing and defeating to the self-esteem. So that came out in the self-esteem support. The growing child and need also came up as your child ages. Those opportunities to belong to a group change. And particularly become more strained when the child is no longer in a school environment, and what some of those crossing over moments actually really feel like. And then where do you, if you can't find that belonging, who do you turn to for the emotional support? And it cannot sometimes always be your partner, even though they're experiencing the same thing that you are, or in the same parts of life that you are experiencing, because it needed more, we need more emotional support independently. And then we did talk a little bit about, and no one in our group, and we got caught out of the breakout room as we were really getting into this conversation. So there may have fact been one that no one in our group had really had a professional check in with them about their emotional well-being as a caregiver during their journey, which was interesting. I think otherwise everything else was pretty well covered. I mean, we had some really good tips and tricks, like, if you want tangible support, be really specific with the ask that you're making, and it will more likely come. Don't just say, I need help shopping, say, I need help getting this, and this, or, so.
Yep.
I think that's it. I think I got it all.
Well done. I don't, our group hit many of those themes as well. And I'll just mention what a few things that I think I didn't hear. We, also to echo the question, how can I help, is not helpful, because now suddenly you have to conjure up your wish list, and what you want is people to just show up with how they can help, and undoubtedly it will help in some capacity. One observation was that several parents observed that they really appreciated how this film never questioned the parents' love and devotion and commitment to their child. So it was never in question, why am I doing this? The burden of caregiving was front and center, but it was never positioned also as the burden of the child. It's that we love these parents, all of these parents love their child unconditionally. That is not in question. The burden comes from the lack of support, lack of resources, lack of understanding, which has nothing to do with what's happening in the primacy of the family, in the primacy of the home, and in that parent, family, child connection. And they really appreciated the fact that the film presented that and honored that really beautifully. We also heard that there is a desire to get this film showed as far and wide as possible to others, to help others in your circle understand what it's like for you. And so Courageous Parents Network is going to speak to the filmmakers to see about how that might be arranged. I have no idea, but I just want to be responsive to you. There was an appreciation that the film did feature policymakers, or sort of, so that there was a recognition that this wasn't just about the parents expressing what it's like for them, but that there was validation from people who are doing this work on the outside, who are saying, yes, we see this is a problem. And I think there were two featured, a clinician and a policy person. Yes, this is a problem. Colleagues, this is a problem. And then social media was very much recognized as the most effective tool to reduce isolation, because it helps you be in community with other parents just like you. And I think, another point, I don't think anybody's mentioned this. A parent mentioned that, wish the film had spoken more to how parents are pulled in so many different directions. And the example was given, all the different ways you as parents have to advocate for your child's needs, finding a summer camp, finding the right teacher in school program, IEPs, medical insurance, that you have to advocate for your child in so many different ways. And there just isn't enough time for all of that. And I observed as a follow-up that you are often, advocacy training is made available to parents, which is great, because if no one else is doing it but the parents, but advocacy training is yet another thing you might feel like you have to do. Oh God, now I have to be trained to advocate. And you do, if you want to be able to affect change, and yet why should you have to add one more thing to your plate? Sort of the injustice and impossibility of the whole thing. So that was flagged. All right, it is 9 o'clock. It is 9:04 actually here on the East Coast. Jennifer, anyone who's welcome to stay, we will keep going and open it up to you talking. We're a small enough group that you could raise your hand and we would love to have just open it up. Now, we also understand if you have to go. Jennifer, will you put into before you go, we do have, we want to encourage you to attend. We have an upcoming event in September, I think, called Just Show Up, which is targeted to extended family and friends for how to show up for people, for parents and families like you. So we hope you will forward that to your friends and family and tell them to attend so they know better how to show up for you.
And you can already register for the event. I'm going to try to get it and put it in the chat right now, but also it will go out in the follow-up email that all of you will receive. So if you don't get to capture it out of the chat, don't get stressed out, but you can already sign up for it.
Mm-hmm. I'm looking at things that you have written here.
And for those of you who might even be considering it, you might want to look at our event page. We're also hosting, and this is not related to the topic, but we are hosting an event on traveling with a medically complex child as well. So when you go to the Just Show Up event, you can also back up and see the other event that we're hosting.
Erin, can I ask you, as we open it up to chat, what you mean by infrastructure support?
Yeah, I think I know Barbara is on the call as well as Alicia. Several of us are working with, you know, trying to advocate with long-term services in the state to really think about infrastructure and what does respite mean to all of us. You know, there's funding right now out there. They're ready to just kind of throw funding out without really being thoughtful about it. And when I was looking at the list of needs, I was thinking that infrastructure might be something to be looking at as well.
Mm-hmm.
Tennessee is by far from perfect. But hearing some of what y'all are saying, you know, well, like first of all, we just got Katie Beckett. You know, how many decades after everybody else? But, and so I didn't have any help until recently. I think I got maybe 1,000 or 2,000 a year from family support, and there was still a waiting list for that. But we had Tennessee was the first to enact the CMS regulations that you could no longer have day programs and day services, and you needed to be in community. The problem is that it is at best, at the least, a part-time, if not 3/4 time job, and a savvy skill set that needs to go with it. But my daughter has job coaching. The only way she would be able to work, she's worked at TJ Maxx with a full-time coach 9 hours a week for 5 years now. And that was through the program, Employment and Community First Choices, ECF choices in Tennessee. I have respite, I have caregivers, I have somebody that comes and gets her ready and then takes her to work. So it's by far, we've got the same crisis everybody does. I mean, I've limped along with only one caregiver during the pandemic, and the quality's getting more marginalized of what I can find because gas prices and the pay structure and whatnot. So it's by no means perfect, but it kind of breaks my heart to hear that some others don't have what I have, as buggy as it is, and as much as it demands of me.
Yeah, it is the fact, I mean, the fact that so much of our experiences are dependent upon what region of the country we live in and what state we live in with regard to how Medicaid is out, Medicaid state, you know, the money that comes to states for Medicaid. And I'm sure you all know that people will literally either move or decide not to move, take jobs or decide not to take jobs specifically to get better services, which is extraordinary.
One thing, I'm a retired social worker. I live in Philadelphia, so I'm putting that hat on for a minute, which is to say that there's so many communities that we just don't hear from. I mean, you know, in these kind of forums, and so many forums that I think have a whole host of perspectives to bring to the conversation. And I think it's, you know, we have to find ways in including those and seeking them out as we talk about policies that make sense for all families.
Yeah. No, I appreciate that. The bringing in more voices from different backgrounds, socioeconomic, racial, cultural, is something we are always trying to do here at Courageous Parents Network. So I appreciate your saying that. I think we're going to end at about 9:20 or 9:25. So that's, let's say, 10 minutes from now. So speak now, please.
I wanted to touch on that last comment if I could. I think it's not just Medicaid, but it's the school systems too, and like the therapy services they provide, because we moved from Kansas to Texas in early 2020 at the beginning of COVID for medical, because the medical services we had in Kansas were not what we needed for my son, and so we came down here to Houston to get what he needed. But I basically say that we got the medical we needed and we lost everything else. School services, community services, therapy services, everything else is gone. The schools down here can't provide for him. They won't provide a one-on-one, which he has to have to go to school. So he can't go to school. He has to be homeschooled. Schools in Texas don't provide at least in our area, don't provide therapy services during the day anyway. Compared to Kansas, he was receiving PT, OT, speech, vision, and audiology all during his school day. And then just in the community, it to me is not as welcoming. And I don't know if that is maybe biased because of everything else that I've encountered since being here, but I know he gets ridiculed when we go out in public. He gets called names, made fun of, and it just seems like a really, and I don't know if that's a lack of inclusion, but I think a lot of it starts in the school systems too, I guess is what I'm getting at.
Well, you, Heather, have just named that you've just put a very specific point on the extent to which trade-offs. There are always trade-offs, and you've named really probably one of the biggest ones there could be, and that feels like almost an impossible choice: medical care or socialization and education. Like, why? How can? What an awful choice. That's just not, shouldn't be a choice you have to make. Thank you.
Yeah. I think I'd like to add, sorry, this is Tanya Myers. I'm actually a physical therapist, and I work both in schools and outpatient facilities. And I think I'd like to add to that because I've practiced in a bunch of different areas, including adults in Arizona. But I am aware because I'm with a group of PTs that are working to provide better outcomes for children with complex medical needs. And so I hear from other states, and I think, like, of course, the East Coast tends to have better school programs and also medical systems, but, you know, then you have the high cost of housing. So I think this is such a complicated system, and I feel so much for everyone trying to navigate this. It does seem, as Heather said, like, you know, really a no-win situation.
Have any of you had experience? Thank you very much, Tanya. And have any of you had somebody come towards you unexpectedly and saying, like, we see you and we want to help you? Like, has the opposite of what the film was talking about happened in a positive way, like in an unexpected way?
I'll chime in on that. Just and it's not everywhere, like we've been talking about access and depending on where you're at, but there's a program that did literally exactly that to my family when we were out on a walk. And it's called the Friendship Circle. And there's chapters all over the world. Like, definitely see if there's one in your neighborhood. But what they do is they pair up young teens from schools around the area, and they basically create a buddy system. And depending on what your kid needs, whether, like, maybe this kid comes over and plays guitar for your kid twice a week, maybe they come and take your kid out on a walk, maybe they read books to them. So they do this buddy system, and then every Sunday they hold a 2-hour like fun center, and you can drop your kid off for 2 hours. And there's like tons of capable adults and all of these teens, and they have a bunch going on, and they do that for the families. And then every like 2 months they host a night for like the moms themselves. And they help you find babysitting if you need it and all of that stuff. So just in a little way, that is something that happened to us randomly.
Okay, that's a great share. Thank you so much.
In our town, or the next town over, if you made it to a certain level in Little League, you were required to play on the buddy team. And I use the word require because it did become a requirement, but I will tell you that those kids stuck around year over year over year over year. And my son got to play on a special needs t-ball team for probably 4 years because his buddies stuck with him through that program. So it does just take a little seed, and sometimes you can find those things someplace.
Yeah.
I just wanted to, yeah, thank you. I just wanted to say something to Heather. I did message in the chat. We're in Austin, which is 2.5 to 3 hours away. And if the commute to healthcare was doable, Austin has a school that just built a new campus, and the architect has a child in the school. So there was extra tender loving care. His wife is a nurse for children with medical complexity. It's through the Austin School District. It's called the Rosedale School. And I can't imagine how you would not find a loving, supportive community of families there. There is also a comprehensive care clinic, and it is going to move in September so that it is actually going to be co-located at this school. I didn't go to the opening, but I have seen pictures online, and it's jaw-dropping even in pictures. And I do know a number of families there. My daughter went to the 18+ program there. So just saying, I have to put that out there. Your story really tugged on my heartstrings. It's so hard to lose everything, you know, to save your child's life, I would imagine.
Thank you.
Ivy, I'm so, yeah. That sounds like an amazing place and an amazing team that put it together. And I'm looking at, Suzanne is putting a list of some of the few but amazing respite homes that we have in this country. Ryan's House, the George Mark House, Ryan's House in Arizona, George Mark in California, Crescent Cove in Minnesota, Ladybug House in Oregon. These are amazing. I mean, every state should have 3 of them, 4, 5, 6. They just don't exist enough. Anybody else have something like another thing that has a positive example of something coming towards the scene piece? Oh, and Nancy, I'm seeing, no, the homes are not, the homes you reimburse for, they reimburse to, sometimes it's a hospice benefit, might be a palliative care benefit. They get paid for it. They're not federally funded though. I mean, they may have federal funds, but it's not a public agency. For those of you who haven't watched the film, the follow-up email will include how you can, and it may involve having to buy a ticket, which is $10, but CPN sponsored the screening that we had for 3 days. I will see if we can extend that window in some capacity so that you can watch it yourself or send it around to people in your network, or give it to your child's clinicians, or give it to your child's, I don't know, or your just whoever, to say, this is my life, or this is my life, and here's what I would also have you know.
I also want to say that sometimes you can also go on and use some of our CPN videos to do that with people. I have sent a video to a friend and said, could you please watch this? This is how I feel right now. I'm feeling too fragile to talk about it with you, but I want you to know this is how I feel. I've also done the same thing to my husband and said that I feel just like that mom in that video right now. Could you hear her? Because you're not hearing me. So, and if anybody wants to reach out and say, this is my situation, do you have a video that will help me say this on CPN? You can either email connect@courageousparentsnetwork.org or email me directly, which is just Jennifer@courageousparentsnetwork.org.
Yeah, Jennifer is the point person for all of our family outreach. Our outreach to individual families, our outreach to patient disease groups, and our outreach to industry. I do more of our outreach, Janet and I do more of our outreach to clinicians. And Liz is getting involved doing lots of things in other ways. So we are very, very, not just receptive, but we are as responsive as we can possibly be to what we hear from you. The network is only as good as the individuals in the network, which is you. So please, please don't hesitate to email us at connect@courageousparentsnetwork.org if you're not yet well, now you're members actually, because you registered for the film, we will be getting, we send out twice a month, a short email with new stuff that's been added so that to keep you current. We also have a mobile app, which if you don't have it, you can, we're very proud of the mobile app. You can get everything on your phone now through the mobile app. So I encourage you to download it, and you can take, as Jennifer was saying, take a video or a blog post to a meeting with your child's clinician or your child's special ed teacher, or an annoying member of your family who doesn't get it, and say, here, watch this. So that's one of the reasons we put the app there, to make it easier to bring stuff around. Okay, I want to thank you for your time, Jennifer, myself, Allison, Liz, Janet. Want to thank you for your time. You're beautiful people. You happen to all be female. I suppose I should not be surprised. But behind every child, there is often, God willing, an amazing mom. So we salute you, we thank you, and we will follow up and wish you stability, wellness, all of it. These are challenging times.